We call this the Check Your Health panel, and the idea here is that a lot of times you'll go to the doctors to get your risk factors for heart disease measured, like your cholesterol level and your CRP and things like that. But have you ever thought about what is your risk for staying healthy? And wouldn't you like to increase that risk? And without doing any measurements, you wouldn't know where you stood. And so I think it was about 19 years ago when Dr. Riordan, who was the founder of the clinic, decided that it would be a good program to offer to the public the opportunity to come in and check key nutrient levels. You can also refer to these levels as biomarkers because they do mark the biology of your cells in terms of how well your cells are functioning. And in the same way that if you start to run out of gas, your engine won't work very well, or if your oil gets too low, you're going to have problems. In a similar way, when your cells begin to run out of key nutrients, the body has to try to compensate. And very often what we call disease or symptoms are really manifestations of the body attempting to compensate to deficient levels of key nutrients. What's different about nutrients in this sense is that they are very team-oriented. And even though we'll sometimes say, well, magnesium helps you to prevent spasms, and lutein is good for preventing macular degeneration. In reality, all of these nutrients work together as a team. And in many cases, what you're looking for are the gaps in your team. Where are the low levels? Because that weakest link may be the reason why the rest of the team isn't functioning up to par. And so when you start to have symptoms, you can just bet that one of two things is happening. Either you've started to run out of something that's very important to your cells, or you have the buildup of something that really shouldn't be there. So either nutrients, or you could call them anti-nutrients, which are toxins. So a buildup of the toxins can interfere with cell functionings. For example, certain metals like lead, cadmium, aluminum can interfere with the enzyme systems that run your cells. And so if you're having symptoms, or if you have an abnormal liver enzyme, for instance, it could be manifesting a sign that you're having a toxicity that's interfering with your cellular functioning. So part of what we're doing here is helping you get to know your body a little bit better. And that actually used to be the name of the program. It was Know Your Body, Know Your KYB. Beat the odds by knowing your bodies and kind of becoming familiar with what your nutrients levels tell you about your genetic heritage. Because very often we find disease patterns running in families. So this month coming up here is Alzheimer's month. Well, that can be something that runs in the family. Is that due to genetics, or is it due to family behaviors or certain eating behaviors? It could be a combination of both. And unless you have some knowledge of what's going on with these key levels in your body, you won't know how that's affecting you. You don't know where you stand. So in a sense, by doing your Check Your Health testing, it gives you an inside look at your cellular functioning and gives you an opportunity to go ahead and start making some adjustments either in lifestyle, in diet, or in supplementation, or in maybe some toxic behaviors that you have that you kind of keep thinking that, gee, I'd like to change this, that, or the other, but not quite motivated enough to do it. But very often we'll have people come in who are smoking and they'll be very, very low in vitamin C because smoking will use up their vitamin C reserves. And so, yeah, they could take more vitamin C, or they could use that as a motivation to take that next step towards smoking cessation, for instance. So there's a number of ways you can approach your nutrient level. So our job today, kind of think of us as having an appointment with one another. I'm your doctor today, and I'm here to answer your questions about what your test results mean. So I won't be able to go into great depth, and it's not that we want to go into a huge depth, but today we want to at least help you understand how to interpret your test results, or to get an idea of what these different test results mean. So I can go ahead and take your individual questions, or I can also just kind of start through and start talking about some of the different testing and what these different tests mean. Anyone have any questions right off the bat? We do have some very good multivitamins, and if a person had no access to testing, or if that person was in relatively good health and they were eating very well, and they were using organically grown foods that had no pesticides, and they had no stress, and they had no family history of disease, and everything else was just perfect.
Okay, so no multivitamins.
Well, I think a multivitamin has some value, and there is quite a bit of research, like my good friend Jack Challam, who wrote The Inflammation Syndrome, he wrote the new addition to that, and he put a chapter in on the benefits of a multivitamin in terms of helping you keep your inflammation level down. And like I said, if you really had no access to individualized testing, I think a multivitamin is a very good idea. There's all kinds of different multivitamins out there. I mean, there are the very low food grade type of multivitamins that are not complete. And a multivitamin is not really meant to replace food. None of the vitamins that we sell here replace food, because food is still nature's way of getting us that synergy of nutrients, that kind of orchestration of nutrients that you can't get by just taking a vitamin or even a multivitamin. Now, there are many companies that are trying to create food-based multivitamins, and I'm very intrigued with this notion that they take food substances and concentrate them and put them together as a way of improving, as a way of kind of simulating a whole foods diet. And actually one of the criticisms that people will make about people who take vitamins is that, oh, well, if you take a vitamin, that's going to be tempting for you then to eat poorly because you're taking a vitamin. But what I find is actually the opposite. I find that most people that become interested in nutrition and start looking into their own nutritional status, they actually become more inclined to make better food choices. It's one of those things that the more you know, the more you're interested in taking better care of yourself. Not always the case, but more often than not it is. Now back to your question, one of the problems is I don't know what the best multivitamin is. We do find people who take one type of multivitamin and maybe there's an ingredient in there that they're reactive to and they feel bad when they take it. And so I kind of encourage people to try different multivitamins. Some of the multivitamins are geared more to people with certain conditions, like we have Cardio right upstairs, which is a very good multivitamin, but it's kind of geared to people that have heart disease. It was actually designed by Linus Pauling, and it's got some ingredients, lysine and proline, which specifically help you make better collagen, which prevents you from damaging your arteries and building up plaque at those damage points. We also have Vitalize, which is a multivitamin, but it's kind of geared to people that have macular degeneration. And you can use, it's got quite a bit of the beta-carotene and the lutein and the zeaxanthine and the various carotenoids that are good for the eyes. So that would be a reasonable thing for a person to do if they did not have access to testing, or if their tests show that about 4 of those things they're low in, it'd be easier to take a multivitamin that had all 4 of those things than to take 4 different individual nutrients. So again, even with multivitamins, I think it's nice to kind of use them appropriately as opposed to thinking of them as just a catch-all. Dr. Riordan used to refer to them as shotgun therapy. And you can knock a bird down with a shotgun. I mean, that's fair enough. Sometimes a specific rifle shot will get the job done more effectively for a person, and especially if you have a deep deficiency. One of my favorite quotes is, when people say to me, what is the most important vitamin? Does anyone in the room know what the most important vitamin is? It's the one you're lowest in. Well, how do you know which one you're lowest in? Well, this is the value of Check Your Health. Because if you're really low, if you've got a really deep gap, think of this as a 10-foot hole, and you put 1 foot of dirt in based upon your multivitamin, because a multi is just going to have a little bit of everything, and so you put 1 foot of dirt in, you haven't filled in the hole yet. You've addressed it, but it's not filled in. And so the reason we have individual nutrients is that very often we find that people have deep deficiencies in key areas. And for them, we need above RDA doses of a nutrient to correct that. And then one more step, we also use what's called orthomolecular doses, because like with vitamin C, we know that in super high doses it can help treat cancer. Or niacinamide, in super high doses it can treat osteoarthritis or anxiety disorder, various things like that. And so we can use nutrients in a lot of different ways besides just take enough to make sure you have the recommended daily allowance. It'd be like saying, let's hope that everyone gets a C-. And you know, that's better than a D. But I would rather we shoot for optimum. It's always been fascinating to me that in our culture, we want the best of everything except nutrition. You know, we're willing to we'll get by with whatever kind of gets us by. Now, there's a growing awareness, I think, of people realizing that an optimal nutritional status is better than a get-by status. And so we'll tend to pay extra money to get the super clear 3D television set, but we try to get the cheapest foods we can find, you know, and very often those foods have substandard products in them and very little nutrition. So what we're doing here at the Riordan Clinic is attempting to help people optimize their nutritional status, and this is where nutrient testing can individualize what you specifically need. Okay. Long-winded answer, I'm sorry.
No, that's good.
Yeah, Linus Pauling and Matthias Rath were two doctors that really looked carefully at this question of what does lipoprotein A mean. And lipo means fat, and protein is a protein, so it's a kind of a molecule that's made of both those things. And lipoprotein A is made by the body to repair damage to the inner lining of your blood vessels when it doesn't have enough of what it normally should have to repair that. And you say, okay, now what does that mean? Well, Rast and Pauling made a very interesting observation. First of all, they asked, why don't animals get heart attacks? Their bodies produce vitamin C, in most cases except for humans, primates, and guinea pigs. And primates, if living in the wild, eat a lot of fruits and things like that that contain, I think they estimated that a gorilla will consume about 6,000 milligrams worth of vitamin C in their normal diet. And who was it that someone was saying, that we feed our zoo animals much better than we feed ourselves, and that we have specialists to make sure that they're getting the best kind of diet. But not here, not necessarily.
I read one time that humans used to have the gene for vitamin C, but along evolution or whatever.
We still have the gene for vitamin C. It's a gene that makes an enzyme, L-gluconolactone oxidase, which converts glucose into vitamin C. The problem is that the gene is mutated and it's no longer functional. And there are people that are interested in trying to reactivate that gene. Wouldn't that be interesting if we could all start making our own vitamin C again? But back to lipoprotein A. What Rast and the other question that Rast and Pauling asked that I thought was very interesting is they said, why do we get heart attacks and strokes? Isn't that the predominant type of vascular problem that people run into? Heart attacks and strokes. Well, why don't we get like a hand attack or a foot attack or a left kidney attack, something like that? And you can get necrosis of your kidney, but it's very, very rare. But heart attacks and strokes are very common. Well, the reason is that when your heart beats, the ejection fraction, the blood that's pumped out, is pumped out with quite a bit of force. And it hits the ascending aorta, and there are 4 arteries that come off right away. There's the 2 arteries going up to your head, the carotids, your carotid arteries in here, and then there's the coronary arteries that come off the aorta that goes, of course, to your heart, and your heart has to have a blood supply. So those 4 arteries take the brunt, the aorta and those 4 arteries take the brunt of the ejection force of the heart beating 100,000 times a day. You know, if you calculate it out, you know, it's about 72 beats a minute, 60 minutes an hour, 24 hours a day. Multiply that all out, it's about 90 to 100,000 times a day that your heart serves you by continuing to beat. Thank you, heart. And so, but every time it does, that shearing force of the hose stretching a little bit, little microscopic tears and injuries can occur in the lining of the arteries. Now, if you've got adequate vitamin C, lysine, proline, and a couple other key nutrients, you can go ahead and make collagen and repair that. But what if you don't have those nutrients? Remember I said that if the body's lacking certain key nutrients, it has to do something else to survive, because it's pretty darn important that those tubes stay intact. And if they don't, that's it. So what the body will do is, if an injury occurs and it doesn't have enough nutrition to create the actual scab, it'll create a kind of an artificial scab made out of lipoprotein A. So large amounts of lipoprotein A in the blood is a suggestion that you probably do have some deficiencies that's setting you up for your body to make more of that. Now, what we do find is that this tends to run more in certain families. It's not necessarily just depending upon what you eat. It depends upon how well your body utilizes certain nutrients, and this is the biochemical individuality that we see. So for some people, they may need 500 milligrams of vitamin C a day or 1,000, whereas other people, the 60 per day or 100 milligrams per day that the RDA talks about, that maybe is enough. Depends upon how much stress you're under, what other kind of nutrient factors are going on. Are you under, or do you have other toxicities at work or infections? You know, we're now finding that a lot of these plaques that develop in the arteries have some kind of chlamydia or mycoplasma infection in them. So people who have chronic gum disease and mouth infections are much more prone to heart disease. So it's not just one thing, it's a lot of things. People that grow up in societies that use a lot of chlorine, like Western society, chlorine is an oxidant. There's a higher incidence of heart disease in chlorinated water supplies than there is in more primitive water supplies. So all these factors, put them all together, and it involves the lining of the arteries getting damaged. Do you have the right amount of nutrition to repair that damage? If you don't, it may show up as a higher lipoprotein A. Now, what we usually recommend is certainly niacin, because niacin can have some healing effects. But if someone also had this high lipoprotein A, this is where I might recommend Cardiorite, because it's a specialized multi-nutrient that has extra lysine, proline, vitamin C, and some of the other B vitamins in it to help promote healing of the arteries. And that's why Rath and Pauling specifically designed that formula.
This is a written question from someone.
Oh, yeah.
I'd like you to read it.
Okay. Okay, so here is the background of the question. At a test panel review luncheon a few years ago, I had test results which showed high vitamin C intake but low absorption. You recommended that I take vitamin C, then a pill, now a powder, and something containing vitamin C such as an orange. Obviously, the natural vitamin C in the orange was intended to work as an absorption catalyst. When Dr. Kirby, educated in a different school, heard this, she expressed doubt and advised me to forget that. I note that it took another 6 months for her to explain that I needed to take the vitamin C in smaller amounts more than once a day. So, for the benefit of non-diabetics, do you still recommend the orange and other high vitamin C foods as an absorption catalyst? And for all of us, do we benefit from taking our vitamin C with breakfast, lunch, and dinner and bedtime, the 3 meal times only, or choice Z, other? Okay, well, I was just on the phone. I don't know how many of you have ever been to Mercola.com. Joseph Mercola is a doctor that has a very extensive following online, and he sends out an email once a week, I think, or twice a week to about 2 million different addresses. And so he had me on his show to talk about vitamin C, and this very question was brought up. And he's very interested in this, what we were talking about earlier in terms of nutrients don't act by themselves. They act as part of a team. And so many of you probably have heard of taking vitamin C with rose hips or from rose hips, or vitamin C with bioflavonoids. And this is the idea that if you can get a vitamin C in a way that simulates how it often shows up with food, because some of the very high vitamin C sources that we get in our diet are like from citrus fruits or other berries, these sorts of things. These foods are loaded with phytonutrients, and phytonutrients are colorful pigments that are very powerful as antioxidants. And they probably do help with absorption, but they may do other things to improve the utilization of vitamin C. So now if we're talking about vitamin C as part of food, like food vitamin C, then I think you don't need to use very much at any one time, maybe 200 milligrams, and taken as part of a meal that has colors in it. I mean, if I don't know how many of you have been to my lecture on the color code, but nature has already coded a system to tell us what are the best foods, which is the more colorful, the better the food. Now, I'm not talking about M&Ms here, but I'm talking about naturally occurring colors. The more colorful, the higher the content of nutrition and fiber, and probably the better for you. So you'd want to have a plate, and this is not anything different than what any nutrition school would tell you. Have a plate with many different types of foods with lots of colors in it, and that's going to give you some of your very best nutrition, probably because these phytonutrients are going to help your body make better use of some of the fundamental nutrients like vitamin C. That's one use of vitamin C. Now, at these higher dosages of vitamin C, you get some additional immune help. You have your brain make more endorphins. You get some pro-oxidant effects of high-dose vitamin C, which is part of what we use to treat cancer patients with. The vitamin C acts as a detoxifier. Now, at these higher doses, it's not so crucial to have the same amount of the bioflavonoids or the food ingredients, because now we're using vitamin C almost as a medicine, not just as a food, but as a medicine. And so it depends upon what you're trying to do with your dose of vitamin C. I take quite a bit of vitamin C, partly because to help adrenal function. If you ask what is the highest concentration of vitamin C in the body, it's the adrenal glands. And so there's an interesting story that the primitive Eskimos, during the winter months, they don't get a whole lot of fresh fruits and vegetables up there during the winter months. So where are they getting their vitamin C? Well, they get a little bit from fresh, that you would eat the seal meat raw. And so raw meat does contain extra vitamin C. So they get some there. But the other thing that I heard is that the tribe, when they would kill a seal, they would very carefully dissect off the 2 adrenal glands off the top of the kidneys and cut them up into small pieces, and made sure everyone in the tribe got a little piece of adrenal so that they would get that extra vitamin C or whatever else is in adrenal glandulars to help them maintain a vitamin C level. And none of them really experienced scurvy. So they were evidently getting enough to get by. So I think the answer to this question is that depending upon why you're taking the vitamin C, the best advice is to eat your really good whole foods, colorful meal to get all those phytonutrients, and then take vitamin C according to either what your profile shows, or you can also use the urine dipsticks, the VitaCheck C sticks, to monitor the amount of vitamin C that's coming through your urine. And if you stay fully saturated on that most of the day, then you're taking enough and your body's getting rid of the excess. Whereas if you're testing your urine and there's none there or very little there, your body's utilizing every little bit that you're taking, and you probably could give it some extra to help out. here's you. The hole is pretty low in the glass here. And then here's someone that may have a more average kind of threshold for urinary vitamin C. So if I were to pour water into this cup, I could pour quite a bit in, and there's still not any coming out the side here. But on this cup, I wouldn't have to pour very much in. This is you. You have a low renal threshold for vitamin C, which means that you take the vitamin C in and boom, it's coming out pretty fast. And this is that biochemical individuality. Different people have different levels of how their body handles nutrients. And there's a big discussion going on about vitamin C. Mark Levine published a study where he said there's no need to take any more than 200 milligrams of vitamin C per day, because if you do, it's just going to come right out in your urine. Well, he was using a computer model, and that assumed that everyone had the same renal threshold, but different people have different renal thresholds. Also, if you do take your vitamin C many times a day, even like this is you, what could you do so that you get enough vitamin C and not always having it leak out this? You could put a little bit in the glass, drink it, put a little bit in the glass, drink it many times a day, and that would in general give you a better plasma level. It's inconvenient, but you could have a 500 milligram vitamin C or something in your pocket, and every hour or two take one. And you probably wouldn't lose as much as if you took maybe 4,000 once a day, because if you take 4,000, that's like filling the glass up, but low renal threshold, you're going to lose it pretty fast. We do now have time-release vitamin C, and actually at this last symposium we had a doctor from Canada who wanted me to measure her vitamin C at 4 o'clock in the afternoon, because she, for her, the last so many years has taken time-release vitamin C, and she wanted to see if her level was still high, having taken her time-release vitamin C in the morning, see if it's released slow enough to where she's still having a fairly decent serum level. So that's one thing we could do with you is switch you to time-release C, and then redo the test and see how you're holding out about 4 o'clock compared to 9 o'clock in the morning when you take your vitamin C. Yeah, it varies quite a bit by person and why you're taking it. I mean, Linus Pauling said that everyone should probably try to take about 2,000 milligrams a day, and we sometimes call that the Linus Pauling dose. That's a generalization, and he thought that that would reduce the incidence of colds and flu in people, and I think it does. Some people need to take more. 2 years ago, I had a really bad respiratory infection, and I made it a point to take as much as my bowels would handle, and so I end up taking about 10 grams a day, and I've found I've felt better and done better. Now, I've recommended that to other people, and they say my bowels won't let me take that much. And of course, it depends on which type you're taking. There's many different types. There's ascorbic acid, there's sodium ascorbate, calcium ascorbate. We have a bioenergy C. There's a liposomal C now. So you kind of have to check with your doctor, check around, try some different things. But in general, the reason I take what I do is that I'm thinking like the animals in the wild. I kind of feel like the world we live in is pretty stressful, and the world that I live in is pretty hectic and a lot of work and stuff that I have to do every day. And I used to have more trouble with adrenals, so I'm trying to support my adrenals. And so for me, that's the right dose. That may not be the right dose for you, and that's kind of something you have to kind of try some different levels to see what works the best for you. Because that's what I'll do on an individual basis. I try to get to know people and see what their health issues are and what their stressors are and what's going on. And then, you can use nutrition as a buffer against the stress of the world, is my feeling. Because otherwise, there's a lot of stress that we cannot control. How many of you have heard the Serenity Prayer? The Serenity Prayer is, grant me the serenity to change the things I can change, accept the things I can't change, and the wisdom to know the difference. So I had a patient that gave me his version of the Serenity Prayer. I'm going to change the things I can change and the hell with the rest of it. So I don't know, however you want to handle that, but I think extra nutrition sometimes can make a difference in terms of helping you deal with some of the stresses in your life. Well, here's the interesting thing on that. Beta-carotene is 2 vitamin A's hooked together. Did you know that?
No.
It's 2 vitamin A's hooked together, and that's why a lot of multivitamins now, you don't even see vitamin A in there. It's just beta-carotene, and part of that is that some people are a little bit afraid of vitamin A, you know, that maybe pregnant women can get too much, and so that's possibly an issue. The other component of this, though, that you might be seeing in your report, I'm going to bet that your beta-carotene is high and your vitamin A is low. Yeah. And what we think, Dr. Jackson, who used to be the head of our lab, was very much into thyroid physiology, and he said if you have an underactive thyroid, you won't convert, you won't be able to, right, you won't be able to break that bond to separate the 2 vitamin A's in the beta-carotene, and so you'll tend to run low. So he thought that would even be a good thyroid function test, is to do a ratio of beta-carotene to vitamin A. So what I usually have patients do is, look into trying to improve your thyroid functioning, but also you can take a little extra vitamin A and just kind of bring that up, and then you know you've got plenty of beta-carotene. So. The fasting glucose is going to be kind of a general function of that morning, whereas the hemoglobin A1C is the average of the last 2.5 months. So you maybe in the morning have a little bit more glucose intolerance than you do in the rest of the day. Now, why that is, I think that's just part of prediabetes. And my own theory is that, and this is when Penny mentioned that we are in December, I'm going to give a lecture on the physiology of visceral fat. We tend to think of fat as just one thing, fat, and we're not too happy about it.
Would that be insulin resistance if you're not diabetic?
Right,
Yeah.
right. And so the regular structural fat, there's really 3 kinds of fat. There's structural fat, which is not bad. That's what gives our face depth. Babies have a lot of good structural fat. And then there's reserve fat, which if we eat a little more than what we need, the body will store that as some calories. We can access it and burn it, and we're fine. But then there's this darn visceral fat, and I'm going to show a slide that I have of a CT scan of a person with low visceral fat and a person with high visceral fat. And the visceral fat tends to collect all around the organs, or the viscera. And this visceral fat is very pro-inflammatory. And the research is very clear that inflammation, excessive inflammation, makes you more insulin resistant. As a matter of fact, metformin, which is used for type 2 diabetes, helps reduce the inflammation in the liver, which reduces your insulin resistance in the liver, which helps you lower your blood sugar. But to a certain extent, some people will lose some weight on metformin, but it doesn't necessarily help you get rid of all the visceral fat. And the big problem with visceral fat is that it will store calories, but it won't release calories. It's like an account where you can put money in, but you can't take it out. And so it tends to build up, and you can't get to it. And so then it creates more inflammation, and inflammation can cause...
What does the thyroid have to do with any of that?
Unfortunately, the thyroid, and I've tried this for years, some patients...
My thyroid shows normal on the T3 and T4. I had that test done, but the TISH is high.
Okay. How high is it?
It's
Like,
3.6.
3.6. See, Dr. Jackson, as I mentioned, he was very interested in thyroid. He was a member of a national endocrinologic organization who felt that the normal TSH range was put too high.
My doctor says I have a normal thyroid.
Right. Yeah. Most offices will put the TSH at an upper level of 5. But Dr. Jackson said, no, if you've got the beginning of decreased functioning, It's over like, what is it? I forget what our normal range, but
See, theirs is 4.5 on my doctor's, and you guys have 2.8.
2.8. See, Dr. Jackson put that based upon the organization, endocrinologic organization he belongs to. You're in kind of a gray zone. I would say you're beginning to show some thyroid problems. Thyroid alone, though, is not going to solve this. And it's very clear among most endocrinologists, you can push thyroid up. It'll help your metabolism, but it won't solve the problem of visceral fat. I've seen some people take extra thyroid. They'll drop some weight, but very often they're losing structural fat.
I think I have insulin resistance because I have, like, if I don't eat, I'll get what you call silent migraine, where you can't see, but
Right.
I don't get the pain.
Yep.
And I can drink orange juice or something, and it'll go away.
Right, you're having hypoglycemic reactions, and people who have insulin resistance are more prone to
So is that
hypoglycemia.
why maybe my A1C is down? Or
Yes, yeah, that's that very good point. You know, you're probably having a number of hypoglycemic reactions, and again, the A1C just averages that whole thing. And if you have enough hypoglycemic reactions, it'll pull your
So even
score.
though my 104 in the morning
Yeah,
is
yeah. 104 you're in the pre-diabetic range right now, and pre-diabetics are more prone to hypoglycemic reactions because they have insulin resistance. So yeah,
you just get rid of that with diet, or do you have to?
that's what we're going to be talking about in that special lecture. Yeah, we have a new program that specifically attacks visceral fat, specifically, and that.
Cut out all sugar and most all carbs and stuff like that.
You're doing the right thing, and that's an excellent first step. Right, definitely a perfect way to start. But we have so many patients who've done all that, and they say, "Doctor, still haven't lost any weight." Or I.
Can't sleep either, you know.
That's part of prediabetes.
Part of the thyroid thing, or the
People who have thyroid discomfort or thyroid disorders do have sleep
triglycerides
disorders.
are high, so that's an indication of prediabetes.
Yeah, there's a book upstairs called "Stop Prediabetes Now," which I know the people that wrote that book. Jack Challam and I wrote a book on prediabetes, and that goes into all that. But even there, we didn't really, we had so many people who followed that, and they'll reach a certain point of improvement, but get stuck.
Why do doctors want to put you on Lipitor and stuff like that instead of looking at other things?
Because this is called allopathic medicine. The practice of medicine in the United States, allopathy means against the pathology. And in reality, what they're doing, they're saying that your pathology is your high blood sugar, it's your high cholesterol, it's your high blood pressure, but they're not going a step deeper. What's causing that? What's the cause behind the cause? And the cause behind the cause is inflammation. What's the cause behind that? Visceral fat. So this is why we're really excited about this program that we're going to be instituting, because visceral fat turns out to be a fundamental cause. Now, I think you can still ask the question, what in the world is going on in the United States that so many people are suffering from this visceral fat? Because 50% of Americans, we think, now have prediabetes.
Would your inflammation be normal if you had that prediabetes? Because it's normal.
What was your CRP?
1.8.
That's not normal.
It's not, well, because it says normal.
It says normal, but it's not bad. It's not bad, but it's normal would be probably less than 0.6. Normal or optimal. Normal and optimal, two different things, and that's a big distinction that most doctors aren't making. They're just happy if you're getting a C- on your grades, and that's what I'm talking about. Is it's so ironic in this country that we want the best of everything, but when it comes to health and nutrition, we settle for a lot less. No. No, CRP is a very non-specific marker for systemic inflammation in the body. And unfortunately, it doesn't tell you where the problem is coming from. It could be coming from like a hidden gum infection. It could be coming from a low-grade sinus infection. Some people have low-grade gallbladder disease. Or I don't think you'd have, but osteomyelitis used to be a problem. A bone infection could trigger it. But in most cases, I'd say the visceral fat issue is probably the most. It's the what's looking us in the face, and we're not seeing it.
The most common, if you're overweight and you have this really high CRP.
Because we don't know what to do about it. Most diet programs only work temporarily and it comes back and worse. People have trouble sticking with a diet. They feel terrible on a diet. There's no pill out there that addresses this. So it's, to me, it's a big issue, and we think we have an answer.
There's too much hidden sugar in food that we buy.
Corn fructose syrup is terrible. It's very
It's in everything.
it's in everything. Trans fats are very pro-inflammatory. People are not getting enough omega-3. They're eating high glycemic foods, which trigger excessive insulin release.
And I take chromium, so how much chromium do you need to take? Because mine's, I guess, not very good.
Not very good. How much chromium? Most chromium pills are only like 200 micrograms.
I take 200 two times a day.
That's 400, and what I'm finding with a lot of patients is 1,000. And 1,000 a day is chromium picolinate. We have it in a 200 and a 500 for just that reason, because the American diet is very deficient in chromium, and when you are low on it, you're more prone to prediabetes.
I take vitamin D, but it's not that.
It's not what again, this is quoting Dr. Jackson. It's not what you take; it's what you absorb, what you utilize, and it's how much your particular body needs. And this is where the biochemical individuality is so crucial, and why checking your health, checking your nutrient levels is a step above just guesstimating what you think you need or what the expert says you need. So here we're trying to help people assume better control of their health and their nutritional status.
So if you have the high CRP and let's say you lose the weight, do the program that we're talking about, you would expect the CRP to go down within normal ranges, and if it doesn't, then you start looking at other things.
Right. Yeah, see, I was running, part of this comes from my own experience. When I wrote the book, when I helped Jack Challam write the book on prediabetes, you know what I realized? I was pre-diabetic and had a CRP of around 2, and kind of similar to what yours was, and my weight back then was over 200. And so now, as a result of losing about 33 pounds, my CRP is now 0.4. So you can drop your CRP, and I don't think anything else really changed other than that. And so it's possible to make that better by virtue of losing visceral fat.
What's a healthy range of CRP?
The healthy range of that is 0. Some people actually have a 0 CRP to 0.6. And then it goes up from there, and I think 0.6 to 1.2 is kind of mild to moderate, and there's like 4 different levels. Anything over 1.9, there's an association between high CRP and risk for heart disease. Well, see, this is where I think a supplement probably is. I mean, if it's really low and you need to get it up, you can, anything though that has yellow and orange is going to have carotenoids in it. So pumpkin, squash, let's see, whatever, probably even tomatoes, any kind of yellow-orange types of vegetables will give you extra carotenoids, but it's going to be easier probably to get a mixed carotenoid capsule and take that once or twice a day. Or like this, the Vitalize multi that we were talking about earlier has got a lot of carotenoids in it. And the mixed carotenoids is better than taking just beta-carotene alone. You're going to be, again, simulating food a little bit more like what you would get in food. But because the carotenoids are important not only for vision, but for immune function. And we're getting to that time of year where people are starting to get colds and flu and things like that, so it wouldn't hurt.
They're right in there with vitamin C on that.
Yeah, absolutely. Stop prediabetes now. And the primary author was Jack Challam, who's written about 6 or 7 books. But he wanted my help, and so I'm a co-author on that book. Most people here in the United States are iodine deficient, and we've done testing here on not every patient, but a large majority of patients we've tested, and I've probably only seen out of several hundred, maybe only 2 or 3 that actually had adequate reserves of iodine. And so, so I tend to tell people that, you know, using some kind of an iodine supplement or using, you know, in Japan, seaweed is used. So if you can get kelp or some kind of natural source of seaweed, you're probably more likely to have better iodine levels.
Does that help on insulin resistance too, or not?
Yeah, there is our papers showing that iodine helps. It's not obviously a treatment in and of itself, but it does seem to help reduce insulin resistance. And the one paper, I'm trying to think of the name of the company that makes iodoral is our iodine supplement upstairs. But if you go to the company that makes that, their website, they have about 12 monographs. And one of the monographs is where the author took fairly large doses of iodine and was able to reduce type 2 diabetes in patients taking the larger doses of iodine. So I think it's helpful. I wouldn't depend upon it alone. Each nutrient by itself is almost useless.
Selenium also is good for the thyroid.
Selenium is very important in terms of your conversion of T4 to T3. The enzyme that makes that conversion requires selenium as a cofactor. Here's my analogy. If, you know, when people say, you know, vitamin C or iodine, you know, these are great. And I'll say, okay, quarterbacks. Quarterbacks are great. Well, you send your favorite quarterback against the opposing team by himself and see how good he does in that game. Quarterback's only as good as the rest of his team. And so this team concept is crucial when it comes to understanding nutrition. Now, by the same token, if you've got a terrible left tackle, I don't want to be the quarterback looking at that big lineman and he's going to just run right over my left tackle and grab me, you know. So you need to have all of your players working at their very best in order to be a winning team.
I think the biggest problem is our food chain, or what they do with the food and how they process it and all the
Yeah.
additives they put in it and meat.
Yeah, there's a lot to be desired about the food system here in the United States, and there's not very much incentive for people to, you know, the food companies aren't really interested. They say the only thing that I think sells food companies to do a better job with foods is if they think it's going to sell better. If the consumers demand whole grains, then we started seeing more whole wheat breads. We saw a bottle of ketchup where it said no fructose corn syrup solids, and I thought, wow. They had to. There has to be some consumer demand for that. Otherwise, they wouldn't
Well,
have.
they use it because it's cheap.
Yeah. So if they didn't think they could sell more ketchup by not putting it in, they wouldn't put that on the label. Not necessarily. I mean, you know, now if you don't know all the B vitamins, it doesn't hurt to take a B complex if you're stressed, or, you know, B complex is water soluble. It's a healthy complex to take. Now I'm particularly fond of B5 because, once again, I told you I had adrenal problems, and B5 is known to be very beneficial to the adrenal gland. It also helps improve energy production. It's an anti-allergy type B vitamin. So we do see that some people will have generally good B vitamin levels, and then they'll have one of them really low, like B2 or B5. And so you can't always predict it, but B5 in particular seems to be beneficial for a lot of different things. Yeah, Dr. David Brownstein, who wrote the book Iodine, Why You Need It, Why You Can't Live Without It, makes a good point that you can get topical iodine. And a lot of people do use the iodine that you put on the skin, and you see how fast it absorbs. But that's the inorganic mineral iodine. But potassium iodide is the other form, and he says different tissues in the body require that one too. So the reason we use iodoral is that it's a blend, it's about a 50-50 blend of iodine and potassium iodide. So it's a good one, though I do caution people start with a low dose, because iodine is a very good detoxifier, and if you take a big dose too fast, you'll get headache because it detoxifies bromine and chlorine and the toxic halogens. Well, the B5 molecule fits right in there in ATP. And you need that to make, it fits right in there in the coenzyme A molecule. Coenzyme A is what your body uses to make ATP. So coenzyme A, you can't really take it as a supplement, but you can only make as much of it as you can based upon how much B5 you have. So if you have more B5, you can make more coenzyme A, and then coenzyme A goes into the Krebs cycle, and the Krebs cycle is that part of your biochemistry that generates energy from food. ATP is the way your body stores energy. It's kind of the currency of your cells for energy. And so if you're lacking B5, you can't make energy. Well, your adrenal glands are your body's glandular system for helping you adapt to stress. And so if you're constantly under stress, I always define stress as one foot on the accelerator and the other foot on the brake. And you tend to burn out the engine, but you don't go anywhere. And so if you can release the brake and channel the energy properly, steer the car, then if you have enough gas, enough ATP, then you'll get stuff done. But for a lot of people, they tend to deplete their gas tanks of reserves. Oh my gosh, it's 1 o'clock. Where'd that time go? So anyway, B5 is a really good thing for maintaining good energy levels, and then your adrenal gland helps you kind of appropriately use that energy. So, very good. All right, did we learn something today?
Yeah.
Good.
I'm going to go buy B5. Well, thank you very much for coming. Thank you, Dr.
Thank you,
Ross.
Penny.